The novel COVID-19 virus has infiltrated every aspect of our daily lives, from schools closing, forcing students to full-time virtual instruction, and crippling levels of national unemployment rates, to spikes in COVID cases breaking international records. It's safe to say we need a solution to stop the spread of this virus as we enter into the next year. But how? Hello, everyone. I am Kayla Braggs, a third-year food science scholar with a minor in agriculture business from Atlanta, Georgia.
Hello, everyone. My name is Charles Brown, a fourth-year industrial engineering major from Fort Lauderdale, Florida.
Hi, my name is Nadia Sega, a third-year graphic design major from Hollywood, Florida.
Greetings, I'm Denana Elmore, a third-year business administration student from Irmo, South Carolina.
And greetings, I am Kiara Broner, a third-year facilities management student from Tampa, Florida.
And we are TempCheck.
So for our situational analysis for the internal environment, we have about 4 products. Our products consist of a thermometer, a symptom monitor, a census that reviews on healthcare providers, and location sync to surrounding pharmacies and medical retail locations. For our market, the health tracking app market has been increasing since 2015 by 55%, and it is expected to expand 44.7% over the forecast period. Although there has been a decrease in the sales of healthcare apps, it will eventually increase due to COVID-19. This helps the willingness of people to keep track of their health for the sake of themselves and others catching COVID-19. For our distribution, we will distribute to institutions such as hospitals, assisted livings, urgent care centers, private practice, medical suites, and schools.
All right, for our next situation analysis, we have the external environment. So there's competition with other apps such as ThermoWatch Plus, Miss Rhea, Vicks Smart Temp, and Baby Temp by Baby Doppler. So these apps share very similar characteristics. They overall have great reviews, which makes it more competition for our app. Also, from the technology standpoint, most apps have the same function and use. One thing that's differentiated from our app is that in the other apps, the physicians have access to TempCheck's data, so they can go back and look at each patient that they're reviewing. Also, the advancement of Bluetooth thermometers would ultimately be detrimental to our app in the future. So if the more thermometers that advance and allow them to have interfaces where they can check patients' vital signs and keep track of that in the thermometer within itself, that will ultimately be competitive for our app. Legally, the patent protection, we have to develop a strong patent protection and other apps with similar premise and features.
TempCheck's mission statement is to improve the well-being, safety, and health of communities we serve by providing education and resource to help mitigate present and future healthcare challenges.
So we give you TempCheck. Our app is compatible for not only Apple, but also Google products. So you download it, select your specific insurance provider and the package that you select, which we will discuss later in the presentation, and you'll complete the preliminary health questionnaire to determine your general needs. So for example, current conditions, number of people in your household, specialties required, and pharmacies. And you'll also be able to access your tracked reminders for COVID symptoms as well as other common ailments. This app is perfect not just for healthcare providers, big and small, but also just worried parents for their children. It combines state-of-the-art statistics for technology and the abilities for consumers to stay up to date on all of their health statuses.
So now I'm going to talk a little bit about the marketing objectives. What is our marketing process? First, we want to ensure we have a safe environment for all, but how can we get this out there? We want to allow presence outside of testing cities. We want to show awareness in our branding. Provide incentive trials for top tier subscriptions. Allow customers and consumers to try the highest service possible and being able to try it firsthand. Performing for gaining customer feedback. Providing those mobile health units, and that will allow controlled testing areas for consumers to interact and try the app. Also, to generate revenue, increase the insurance company's participation by 20% yearly and increase subscribers by 35%. That's our goal, trying to get as much people possible downloading the app?
So our specific marketing objectives actually are part of the reason we chose our specific target market. So some things that stick out are women between the ages of 30 and 55. These women typically are going to have children between the ages of 2 and 16, have a family member that is either elderly or immunocompromised, or even have a pre-existing condition themselves. They're actively and engaged in a lifestyle that pulls them in multiple directions at one time. So they have to find ways to save time with the use of apps. So for example, ordering food on time, online shopping, or even grocery store pickups. They also are very calculated in the amount of they spend in their time and their money, and are consistent in their patterns. So they only are using trusted recommendations when applicable.
Okay, now let's discuss our consumer market. We are living in the golden age of technological advancement. Almost anything that we come across has technology. 96% of Americans own a mobile device, which is the reason why we decided that an app would be the best thing to do. And as of March 2020, there are more specialist physicians and doctors and primary care physicians in the world, which is why we are targeting, nurses to use TempCheck. And in the US, there was a total of 92% of the population that has insurance coverage. So one of our strengths is that TempCheck can report accurate COVID-19 symptoms. This is a differentiation from other apps, is that we can accurately report the COVID-19 symptoms. Comprehensive app for symptom tracking, provider search, and other healthcare services. One of our weaknesses is that we are unable to adequately test the app. Before an app is sent out to the public, there are multiple tests that have to be taken, but we are unable to do that. Another weakness is that you have to purchase a subscription to use additional services. Yes, we are offering a free trial, but after the free trial period is up, you do have to pay to use those additional services. An opportunity that TempCheck has is that it's a potential solution to mitigate COVID-19 and spread of other ailments. As we know, COVID-19 is still a big problem and nothing has been solved yet. So TempCheck is an opportunity to get the virus under control. Another opportunity is that TempCheck can be used globally. We aren't just trying to target people in the US, but on a broader scale, nationally. A threat to TempCheck is the change in user technology. Technology is advancing every day. And then another threat is increased competition. As stated before, we already have apps that use the same services that we do, and people are already more familiar with those.
So regarding our 4Ps, we really want to position ourselves as a B2B or business to business product, as well as a B2C, a business to consumer product. With our specific target audience, we want to acquire major insurance accounts as opposed to going after an individualized consumer. So this will be done by sparking interest with informational advertisements played in doctor or healthcare provider office suites, but also with a mobile healthcare unit that we will do COVID-19 and influenza testing to not only embrace the community around us, but also get them involved in what our app is made to do: report statistics timely and accurately with the touch of your phone. And one thing about our product is the different pricing levels. Like we said before, we're really going after insurance companies to be able to bundle our product in their existing packages. So the top level will be the gold, which will be an additional cost to them. So this will be the most advanced search engine. So indicators for specialties, types of insurance, overall customer satisfaction for medical providers, as well as being able to order your medications from your phone. The second level, or the silver, will be the additional of having wait times for doctors' offices and clinics around you, as well as advanced tracking for seasonal flu, chickenpox, and appendicitis. The basic free application will include the tracking for COVID-19 symptoms, as well as fever, headache, nausea, fatigue, and loss of sense or smell and sensations, which includes our in-device Bluetooth thermometer.
So what is our implementation process? How can we roll out this product? How can we get it out there? Dividing it into 3 phases. Phase number 1 is the test launch, and that's pretty much choosing major cities with major healthcare systems: Atlanta, Tampa, Fort Lauderdale, etc., and providing them with the TempCheck and pretty much targeting United, Humana, Sigma, Blue Cross Blue Shield, getting these companies to go along and use TempCheck. Being able to provide them with knowledge and information, and coaching them and teaching them about how we can better the environment. Phase 2 is pretty much rolling out to the customers, and this is a stress test period and pretty much trying out and rolling out the new product and letting limited consumers try it out. And then within phase 3 is the launch, which is pretty much what Kayla was talking about, as a total product business to business idea and business to consumer launch also.
So thank you for listening to our presentation. As you can see here is our team from CEO, Chief Technical Officer, our CPO or Chief People Officer, our CFO, and then of course, our Chief Marketing Officer. Thank you for listening, and I hope you TempCheck details with every degree.